A viewer messaged, "I did Kegels for 3 months and my erections got worse, not better." If that sounds familiar, you're not alone, and the reason may not be what you expect. A 2022 review in a sexual medicine journal noted that when treating pelvic floor dysfunction, situations involving hyperactivity or increased tone of the pelvic floor muscles should be avoided. In other words, if your pelvic floor is already too tight, standard Kegels can make things worse. Let me explain what's happening and what to do instead. Here's the pattern we see repeatedly in this community. A man over 40, you may be dealing with weaker erections, early ejaculation, or a vague aching tension in his pelvis, searches online and finds Kegel advice everywhere. He starts squeezing. He does it daily, sometimes multiple times a day. After weeks, nothing improves. Sometimes the tension gets worse. Sometimes erections become harder to maintain, not easier. And he assumes the problem is that he's not trying hard enough. The issue isn't effort. The issue is that there are two fundamentally different types of pelvic floor dysfunction, and they require opposite approaches. AA, or weak, in pelvic floor benefits from standard Kegels. This is the type described in the original randomized controlled trial we covered in video 3, where pelvic floor strengthening restored normal erectile function in 40% of participants. But AEs, or overactive pelvic floor, does not need more contraction. It needs release. A 2021 review in a sexual medicine journal defined overactive pelvic floor muscles as muscles that do not relax or may even contract to know when relaxation is functionally needed, and identified this pattern as a contributor to sexual dysfunction, chronic pelvic pain, and urinary symptoms in both men and women. So the first question is not, how do I do Kegels better? It's, which type of pelvic floor dysfunction do I actually have? Your pelvic floor is a muscular sling that spans the base of your pelvis, supporting your bladder, rectum, and the structures involved in erection and ejaculation. Two key muscle groups, the EO, which is the base muscle, and the E, the root muscle, each play a direct role in trapping blood in the E's, those two sponge-like chambers inside the penis during erection. When these muscles are chronically tight, several things happen. First, sustained contraction reduces local blood flow. Muscles need cycles of contraction and relaxation to maintain healthy circulation. A muscle locked in partial contraction is a muscle with compromised blood flow. Second, chronic pelvic floor tension is associated with increased nervous system activation, keen the fight or flight state. Erections require the opposite, dominance. A 2025 review in a leading impotence research journal confirmed that pelvic physical therapy, including both strengthening and relaxation techniques, is an evidence-based key first-line treatment for pelvic floor disorders and sexual dysfunction in men. This is why a man with a hypertonic pelvic floor doing standard Kegels can experience worsening symptoms. He's adding more contraction to muscles that already can't relax. What causes this in the first place? Research and clinical observation point to several contributors: prolonged sitting, which places sustained pressure on the pelvic floor and can compress the nerve; chronic psychological stress, which drives unconscious pelvic guarding through sympathetic activation; and somewhat counterintuitively, used overtraining standard Kegels without adequate relaxation phases. Here is a structured approach, not just a single exercise, but a framework. Step 1, self-assessment. Before doing any pelvic floor exercise, answer 3 questions honestly. Do you feel a deep ache or tension in your pelvic region, especially after sitting for long periods? Do your symptoms, including erection quality or ejaculatory control, feel worse after doing Kegels, not better? Have you experienced unexplained urinary urgency, difficulty starting your stream, see or pain during or after ejaculation? If you answered yes to 2 or more of these, hypertonicity is a reasonable possibility and relaxation-based work is your starting point. However, and this is important, this self-assessment does not replace a clinical evaluation. If you have persistent pelvic pain, painful ejaculation, your symptoms that don't improve within 4 to 6 weeks of the approach described below, see a pelvic floor physical therapist. They can perform a proper assessment using internal or surface EMG evaluation to determine your resting tone. Step 2, deep belly breathing with pelvic floor release. This is the foundation. The and pelvic floor are anatomically and functionally linked. They move in coordination. A 2025 study found that deep belly breathing therapy reduced resting pelvic floor muscle activity and perceived emotional stress. Here's the technique. Sit comfortably or lie on your back with knees bent. Place one hand on your chest, one on your lower abdomen. Inhale slowly through your nose for 4 counts. Your abdomen should expand, not your chest. As your abdomen expands, consciously allow your pelvic floor to soften and descend. Imagine the sensation of gently beginning to urinate. You are not bearing down or pushing. You are simply allowing the muscles to lengthen and release tension. Exhale slowly through your mouth for 6 counts. And allow everything to return to a neutral resting state. Do not pull the muscles up. Repeat for 10 breaths. Practice twice daily, once in the morning, once before bed. Step 3, the reverse Kegel hold. Once you're comfortable with the breathing pattern, add intentional pelvic floor lengthening. On your inhale, actively widen and drop the pelvic floor. Not a push, but an expansion. Hold this expanded position for 5 seconds while breathing normally. Then release to neutral. Do not contract. Repeat 10 times. The critical safety note: if you feel pressure in your rectum, if you're bearing down as though having a bowel movement, or if you experience increased pain, you're pushing too hard. The reverse Kegel is gentle. Think 30% effort, not 100%. Step 4, movement breaks. If you sit for extended periods, stand and walk for 2 to 3 minutes every 45 minutes. During standing, she can perform 3 to 5 gentle hip circles and 1 deep breathing pelvic release. This counteracts the sustained compression that prolonged sitting places on your pelvic floor. Let's talk about realistic expectations. A 2014 study enrolled 40 men with lifelong premature ejaculation in a pelvic floor rehabilitation program. After 12 weeks, 33 of 40, that's 82.5%, each gained control of their ejaculatory reflex. The improvement wasn't instant, it took weeks of consistent practice. The protocol included both contraction and relaxation training, not just one or the other. Expect to notice subtle changes, less pelvic tension, improved awareness, within 2 to 3 weeks. Measurable changes in erection quality or ejaculatory control typically require 6 to 12 weeks. Consistency matters more than intensity. If your symptoms include persistent pelvic pain, pain during or after ejaculation, or urinary symptoms that don't improve after 6 weeks of daily practice, seek a pelvic floor physical therapist who specializes in male pelvic health. This is a growing specialty. The evaluation typically includes a physical exam and possibly surface EMG to measure your resting pelvic floor tone objectively. A 2019 systematic review confirmed that pelvic floor muscle training is effective for both ED and premature ejaculation, but noted that no single optimal protocol exists, which is precisely why professional guidance has value. Here's the key takeaway. There are 2 types of pelvic floor dysfunction. If yours is hypertonic, too tight, not too weak, then doing more standard Kegels is working against you. The fix is not harder squeezing, it's learning to release. The 4-step framework, self-assessment, deep belly breathing with pelvic release, reverse Kegel holds, and movement breaks gives you a structured starting point. And if that's not enough, a pelvic floor physical therapist is your next move. Every study we referenced today is linked in the description. You can verify all of it yourself. If this reframed how you think about pelvic health, subscribe for the next video. Drop a comment telling me whether you've tried Kegels and found they didn't help. I think the responses will surprise you. This content is educational and informational only. It is not medical advice, diagnosis, or treatment. If you experience persistent pelvic pain, painful ejaculation, or urinary symptoms, consult a pelvic floor physical therapist or urologist for proper evaluation. Next in the series, we're diving into the gut-testosterone connection. Emerging research shows that your microbiome directly influences how your body metabolizes hormones, and one specific dietary pattern has the strongest evidence. I'll break down the studies and make it actionable. See you there.